Uh, Good day, everyone. My name is Sabri Gul. Student ID number S332754. Welcome to the presentation for the Certificate of Higher Education in Health and Social Care. Today, we are exploring the core module, Introduction to Communication and Interpersonal Skill. Our focus is the skill at the very heart of the high-quality care, assertive communication. In healthcare, assertiveness, expressing our thoughts, needs, and feelings directly by honestly, but always with the utmost respect for others. Effective communication between interprofessional and patient is vital to prevent misunderstanding that lead to clinical error. Today, we will look at how this skill builds trust, improves accuracy, and elevates patient outcome. Introduction to assertive communication. Move to slide 2. Effective healthcare practice doesn't just benefit from assertive communication, it relies on it. In medical environments, patients are often navigating complex, stressful health problems because of this. Clear communication is critical to avoid misunderstanding between provider and consumer. Error in healthcare communication can have severe implications from the patient dissatisfaction and critical medication mistakes. Assertiveness keeps information simply transparent, assuring patients fully understand their diagnosis and care plan. Furthermore, it creates an open discussion system with healthcare into reducing the patient fear of speaking up and fostering a strong culture of feedback and safety. Characteristic of assertive communication. Let's look at what assertiveness actually look like. Think of the perfect balance between passivity and aggression. It means communicating clearly without any overbearing or time. This balance is how trust is established. When we communicate our needs clearly while respecting the patient, we build immediate rapport for the healthcare workers. Assertiveness training also increasing the job satisfaction and decreasing the stress. It allows professionals to voice concern and set boundaries respectfully, preventing burnout. Whether in a hospital or nursing facilities, streamline both verbal and non-verbal communication. Slide 4 identifies strong points of assertive communication. So let's identify the distinct advantage of the skill. Assertiveness is proven assessed for reducing errors in complex medical environment. By removing ambiguity, it builds vital trust within the patient-provider relationship and across multidisciplinary teams. Comprehensive, uh, um, comprehensive care requires seamless collaboration, effective communication, empowers everyone to contribute, ensures patients follow their treatment plan, and promotes the positive stress workplace culture. Limitation of assertive communication. However, as we see on the slide 5, assertiveness is not the one-size-fits-all solution. If applied blindly, it has its limitation. The main danger is that in highly sensitive contexts, such as delivering bad news or comforting an anxious, anxious patient, assertiveness can accidentally be perceived or cold or aggressive. Cultural difference also play a massive role. What feels direct to the one person might feel confrontational in another. In highly emotional or emergency situation, again, the more passive or empathic listening approach is often far more appreciated. We must always adjust our strategy to environment. Application in patient care. Let's look at the slide 6 and talk about the direct patient care. Assertiveness ensures that patients leave the interaction with absolute clarity regarding their diagnosis and treatments. This directly improves health literacy, empowering patients to make informed choices. This is incredibly valuable in the mental health facilities where the patient might otherwise feel intimidated or hesitant to speak up. Communication creates a supportive, structured environment. It prompts patients to voice of their concern early, which leads more accurate diagnosis and higher overall. Application in healthcare teams. Now, let's talk about the slide 7. Application within healthcare teams. Care coordination relies entirely on open communication. Assertiveness gives team members the confidence to flag problems areas before they affect patient safety in a multidisciplinary surgery or care team to ensure that every professional, regardless of their rank or role, can contribute to decision-making process. It clarifies roles, minimize confusion, and streamline or exchange the vital confirmation. The in the slide 8, we're going to talk about the recommendation. How do we strengthen those skills? Slide 8 outlines our care recommendation. First, we must pair assertiveness with cultural sensitivity, tailoring our approach to the individual seconds. We should use role-playing to practice navigating real-world scenarios. We also need continuous education, like regular workshop, to keep those skills sharp and accurately. Healthcare workers must learn to moderate their assertiveness, knowing exactly when to dial up for clarity or dial it down for pivot towards empathy. Finally, establish effective active feedback loop within team ensure ongoing improvement. And the conclusion. So to conclude, as we see on the slide 9, assertive communication is a fundamental skill in health and social care. It transforms patient outcomes, strengthens team dynamics, and protect professional well-being. While it is an incredibly potent tool, its success depends on our ability adapt knowing when to be assertive and when to practice deep empathy listening by continuously reinforcing those skills. We can ensure that those skills we can ensure a safer environment for our patient and more supportive workplace for ourselves. Thanks for your time. I welcome any suggestion you might have.